Hi friends, welcome to our channel Dental Care Hyderabad. This is Dr. Alladi Chandrashekar, dentist and oral and maxillofacial surgeon. Today in this episode we are going to discuss in detail about tooth decay or tooth cavity. Everyone must be wondering how tooth cavity or decay is formed, and everyone wants to know how we can avoid this common problem to prevent pain, discomfort and tooth loss associated with the tooth decay. Usually tooth cavity or decay is identified by blackish or brownish discoloration in the tooth associated with the crack in the tooth or pit in the tooth. If unnoticed or unrecognized, can spread to the deeper layer causing pain and tooth loss. Usually it starts with excess sugars which are present in the food and liquids which we take, and the bacteria which is present in the oral cavity feed on these sugars, producing the acids. The acids which are released by the bacteria in turn mix with the food, bacteria and other food particles present in the oral cavity and forming the hard and thickened layer called plaque, which we usually hear from the social media and from most of the dentists, like there is a plaque formation on the tooth and there is a calculus formation on the tooth. This plaque is nothing but a thick layer of bacteria present on the tooth, which if not removed in time may further damage your tooth by bacterial infiltration. So how cavities can be prevented? Cavities can be prevented by maintaining good oral hygiene, which consists of doing brushing twice daily and interdental flossing twice daily. Brushing and interdental flossing can really remove the plaque layer which is present on the tooth, thereby decreasing the chances of cavity formation. Number 2, using chlorhexidine based mouth rinses regularly. These chlorhexidine based mouth rinses contains antibacterial agent which will act on the bacteria present in the plaque, thereby reducing the bacterial activity. Number 3, avoid snacking between the meals. Number 4, rinse vigorously between the meals. Rinsing between the meals can remove the food particles present on the teeth, thereby reducing the chances of plaque formation. Number 5, maintain good oral hygiene by eating fresh vegetables, fruits and other healthy diet, thereby reducing the chances of plaque formation. As I told you, most of the cavities are asymptomatic or patient doesn't have pain unless until it spreads to the deeper layer involving the tooth root, causing pain and pus formation. So it is mandatory to see the dentist every 6 months, because the cavities present on the tooth usually goes unrecognized or unnoticed most of the times. So it is better to visit the dentist and get your oral cavity checked every 6 months, so that cavities can be filled easily without any pain, rather than going for expensive and painful procedures like root canal treatment and tooth removal. So finally, time to time visit to the dentist is very important to avoid the simple tooth cavities which can turn into expensive deep cavities causing tooth pain and tooth loss. So friends, if you have any doubts regarding the tooth cavity or tooth decay, write us in the comment section of this video. We will respond back immediately as early as possible, and have a great day. Thank you.